Biopsychosocial Etiology and Management of Smoking by Lazina Johnson for Health Psychology 532 class um, by Dr. Green for Kaiser University, June 25th, 2023. In this presentation, there will be a discussion about the biological, psychological, and social factors of tobacco smoking. For this discussion, it will be about tobacco smoking. Smoking still remains as one of the most preventable causes of death and diseases in developed countries such as the United States, according to Taylor and Stanton. More lives are lost to smoking-related reasons than in comparison to vehicle accidents, fire, suicide, homicide, alcohol, drug use, and even AIDS combined. That information came from Patcar et al. In addition, 9 out of 10 lung cancer deaths can be linked to smoking. Taylor and Stanton. Over 480,000 people a year die from smoking and smoking related diseases and illnesses in the USA, according to the authors Taylor and Stanton. About 50 to 73 billion dollars are spent in medical costs related to smoking, according to Petcar et al. Smoking can also be linked to many other chronic illnesses and diseases such as diabetes, heart disease, blood pressure, hypertension, and also stress, other mental illnesses as well. About 38 million people will, about 38 million people still smoke in the United States, which is very alarming with given all the information we now know about smoking, according to Taylor and Stanton. Risk of breast cancer increases 4 times more from smoking after menopause in women, per Taylor and Stanton. Another interesting thing to know is that there can be damages and injuries and fire accidents that can happen from smoking, along with lower birth rate, fetal developmental issues at birth time, according to Taylor and Stanton. Even erectile dysfunction increases by 50% from smoking, by the same authors. It seems that people with psychiatric disorders or mental health illnesses smoke more heavily, or to be precise, twice as much as compared to regular population, according to Morisano et al. Another alarming risk factor is the adolescents. They usually start experimenting with smoking around age 15 years. Along with having direct implications on health, secondhand smokers such as spouses, children, co-workers, friends of smokers are also at risk of many serious illnesses and diseases, which is very concerning because not only it hurts the people that are smoking, but also the people that are not smoking but are just around. So there are we're going to be looking at different factors into smoking. The first one is the biological factor. The um, Padkar et al.'s study actually explains that um, polymorphisms in two enzymes called CYP2A6 and CYP2D6, they actually metabolize nicotine found in smoking, tobacco smoking, and they are also in charge of regulating dopamine, and they have been associated with smoking tendencies and the ability for people to quit smoking. And of course, there is the case of nicotine addiction. Nicotine found in tobacco smoking um, causes an addiction, and it's really hard for people to break that. Let's talk about some of the social factors of why people smoke and why it's hard for them to quit smoking. The first one, of course, here I mentioned is peer pressure. It's really hard for someone to keep saying no if everybody around them is smoking, especially if they're young, like a teenager or an adolescent. As we just previously discussed, that the median age for experimental smoking starts at age 15, and kids at that age are very susceptible to peer pressure. Another factor is lower education levels, as we have also seen in the same article by Patkar et al., that people that have lower level of education usually are not aware of all the risk factors associated with smoking. They don't realize how badly this can harm them. Another one is being a secondhand smoker, as I just mentioned, that people who are around smokers, maybe somebody's parents smoke, or all their coworkers smoke, or a lot of their coworkers smoke. They're just being around smoking all their life, and they start smoking. Lower level of parental interference is definitely another big one, where there's just not a lot of intervention or interference when they are experimenting with smoking or when they are continuing to smoke. Basically, nobody's telling them no, or nobody's educating them on why it's bad for them. And of course, another one is being influenced by the media. Psychological factors of smoking is that a lot of people report that smoking helps them kind of feel at ease when they're under a lot of stress. It sort of acts like an antidepressant for some people, because it does create a feeling of high at the beginning. Also, coping abilities for people in stressful and adverse events also can lead to them wanting to smoke to cope better or feel less stressed. Other personality traits, such as self control or self regulation, are super important in understanding why some people are able to quit smoking or not smoke, and some others are not able to do it. It seems, according to Plewis and Bartley, impulsivity and aggression, people that have those traits usually smoke or tend to fall into that category of smokers. Based on the information we know about smoking, um, there are some things we can implement or practice better that can help us lower the smoking, or lower the amount of people that smoke or how much they smoke. So, smoking cessation. One of the things that is very important to understand is the network phenomena. So, smoking spreads through social ties and groups that are closely interconnected, according to Christakis and Fowler. The chance that a wife or husband or significant other will quit smoking increases by a significant amount, which is 67%, if the other spouse stops smoking. In addition, the likelihood a person will stop smoking goes up by 36% if their friends stop smoking. In the same way, a person's chance of quitting goes up by 34% if their coworkers stop smoking. This particular research was conducted over 32 years and a closely knit social network of 12,067 people, um, and it was summarized by Christakis and Fowler. Smoking and suicide, there seems to be a really strong um, relationship between smoking and suicide. According to Green et al., there seems to be evidence showing that smoking directly reduces a neurotransmitter called serotonin, which is responsible for regulating mood, cognition, reward, learning, memory, and other physical responses that leads to depression and suicidal behavior. Smoking can lead to cancer and other chronic and painful diseases. Patients with cancer can be more depressed from the pain and the immobility they're facing, which can also lead to suicidal behavior. Smoking should be considered an addiction. So Ratchelet explained that it is now overdue time for mental health professionals to regard smoking as an addiction or addictive behavior, like other drug and alcohol addictions, and should implement smoking cessations or intervention strategies in their mental health treatment plans for the individual and on a community level as well. So, continuing the cessation and intervention strategies, one of the things that will definitely be beneficial is mindfulness. So, through the practice of, or through practicing mindfulness, people can learn how to have better self-control, and they can also reduce their negative responses to unfavorable or stressful or adverse events, which also then will reduce their need to receive an outside influence like a dopamine high that some people get from smoking with nicotine. Meditation and yoga can also be very helpful in helping individuals having attention focus, and it has been reported that people are able to perform tasks with ease and effortlessness with meditation and yoga. Social influence. So, one of the biggest things is the increased use of technology, including the internet. Um, it can also be really good for us to use that in spreading the right type of messages to the right target groups. Young generations spend a lot of time online listening to their idols and the singers and the rappers and the gamers. All of them, they have their own network of social influencers they follow, and those influencers should be spreading the right messages for those target groups, so they now understand the harmful effects of smoking, and we need to make this behavior, smoking, a very uncool thing to do. If their idols are making it uncool, then the followers will also follow suit and quit smoking or not engage in smoking. And this is also a good way to educate young generation of the negative and the complex negative effects of smoking. Public policies. So as I have leaning toward this more and more, society as a whole must agree on the importance of spending our tax money on prevention and cessation of smoking. More access to treatment should be available to everyone, especially people in lower socioeconomic status. Therapy, medication should be free. Support groups should be available. There should be counseling, readily available information about how deep the effect of smoking is, and other options must be made available to people of all age groups, with added focus on minorities and people in lower socioeconomic status, as people in higher socioeconomic statuses show that they are able to stay out of smoking 55% more than people that are in lower socioeconomic class. One other thing is the self compassion training. It seems that people that have kindness and understanding toward their own selves tend to avoid self harming behaviors such as smoking and are able to cope with stress better. Counseling therapy. As previously stated, smoking is an addictive behavior. Therefore, the same types of counseling that is offered to drug and alcohol addicts will most likely have similar effect on smoking behavior, such as Smokers Anonymous maybe. Public ban. So one of the articles by Wang et al., we learned about the public ban in Spain, and the result from that study found out that more people were willing to quit smoking because there was a public ban, there was a social ban. So that may be an important step for us as well. There seems to be a very serious relationship between stress and depression and smoking. Stress and depression can make people smoke more than others, and smoking can lead to depression as well, especially in young population. Also, anxiety and panic attacks increase with smoking in adolescents. There is a synergistic effect of smoking, as mentioned by Taylor and Stanton. Smoking has a multi-layered effect on people. It actually works with other risk factors and bring more harm to certain demographics and people with certain dispositions. It hits harder in socioeconomically disadvantaged society. Men sees that their heart rate increases in response to stress, while in women the heart rate drops but increases, the blood pressure increases in response to stress while smoking. Trauma and PTSD increases the chance of smoking. It works like as a binding effect with mental illnesses and lead to more morbid illnesses such as cancer and cardiovascular disease. I personally feel that there is a window of opportunity right now as the society overall is becoming more and more aware of mental health issues, and this should be an opportunity for all of us to learn and spread the word of why we should not be smoking and why we should be loving ourselves more by avoiding cigarettes and tobacco use. And this may catch on to the wave of being self-aware and self-kindness, and that should actually help spreading the right messages to the target group and should help us lower smoking in the country. In summary, I want to remind the readers that smoking is an addictive behavior and it needs the same, if not more, attention as other addictions such as alcohol and drug usage. It is still a major concern as it is one of the most complex health risk factor in our society. More involvement from mental health care providers are needed. We need to make it a practice for psychiatric field or help providers to incorporate treatment plans for smoking as well. There should be more strict and widespread public planning and implementation for the desired outcome. Corporations and the government have to agree to implement policies including banning smoking publicly, which will hurt the corporations, and in corporate America that may be an issue. But for our society to get better, we have to come with to an agreement and work with each other. The social view or the image of smoking must be changed through social influences, and we all have to do our part here. We now have references. And that concludes the presentation.